Welcome to the Battles We Pick podcast, where advocates and organizers talk about their work pushing for social, political, and policy change. Today we have a special holiday edition featuring a conversation with my daughter when they were home for Thanksgiving. Sadie Bendershore is in the early phase of a career in social work, currently working in the University of Arizona's Counseling Center and planning to begin studies next fall for an MSW. Social workers talk about the micro and macro levels, basically meaning service provision versus advocacy, and that's where we started our discussion. For instance, healthcare reform makes a huge difference in opening new possibilities, but more on-the-ground work is needed for people to actually receive care. Sadie explained that much of their own job involves helping University of Arizona students navigate the paperwork and hoops the students encounter as obstacles. And with Sadie's special focus on transgender and other LGBTQ people, they often face an issue with students' reliance on parents' health insurance. As another challenge of prodding bureaucracies to truly serve the populations they're meant to help, Sadie talked about an earlier job as a case manager for unaccompanied minor migrants. That position entailed facilitating family unification for kids with relatives in the United States, as well as advocating for kids in a group home who didn't have that option. Often I start these intros by saying how I know the guest, and in this case, I've known them their whole life. Because today's guest here on Thanksgiving is our daughter, Sadie, who hasn't exactly gone into the family business, but is in a closely related field. Sadie Bendershore is a behavioral health coordinator in the Counseling Center at University of Arizona in Tucson. Earlier in their career, Sadie worked in a center that supports migrant laborers, as well as a family services agency that helped unaccompanied minor migrants reunite with families or receive foster care. So, daughter Sadie, are you seeing anyone? You never write. You never call. Oh, I'm sorry. Welcome to the podcast.
Thank you so much for having me. Season's greetings.
This is going to be fun.
I agree.
For the record, Sadie does write and call regularly. I was just making a cheap joke. Sadie, you're in the early years of a career in social work, and in that field, they talk about micro-social work and macro-social work, which are basically service provision versus policy advocacy. I guess that applies to your current work in the sense that healthcare reform is about the system for receiving care, and you work to ensure people can actually access care. But why don't you explain what you do and deal with?
I think that's a great way to kind of differentiate the maybe more advocacy, big scale policy work versus what I do, which is way more direct care oriented. I work with, as you said, students at the University of Arizona. I work at Campus Health, so within the counseling center at Campus Health. And I kind of do a whole slew of things from helping students access mental health services from counseling, psychiatry, any form of like mental health support or resource, to things even like healthcare navigation. And I've kind of taken on a new, I guess, service that I wanted to get going around like trans healthcare, getting students the kind of gender affirming care that they need. So I have a very large caseload. I work with students individually. They get referred to me by therapists at the counseling center or not. I work with anyone. So it's way more like hands-on, working with people in different situations, and I love it.
Social work, casework is where the rubber meets the road, and challenges affect people and their lives. And yeah, that's a good reminder that healthcare is only meaningful if people are actually receiving it. And it seems like you deal with a lot of just the paperwork, the bureaucratic hurdles of receiving care.
Yeah, I mean, yeah, and I'm working with a population. This is my first time working with adults, actually. Like, most of my work has been with kids.
Right.
So I'm working with like college age people, typically like 18 to 24, although I do work with even sometimes staff or grad students, but I'm mostly working with these younger people who don't really have any experience in navigating their own healthcare or how insurance works, or they're on their parents' plan and they don't know necessarily how to use it. So a lot of my job actually is often troubleshooting that, trying to see where we can pull from to get students the care that they need, and that can look like a bunch of different things. But yeah, it's the part that I love the most, is getting someone who like very obviously needs a certain service but does not have the resources or access, or there's a barrier to care, is kind of like what we talk about, where um, they very obviously need support and services, but either because of a lack of insurance coverage, underinsured, uninsured, no financial resources, basic needs are not being met, that we have to kind of scramble a slew of resources together and pull some strings and try to get them connected. So that's, I feel like, the epitome of direct care and case management, which is kind of the intermediate level of social work.
Right.
But yeah, that's just a little bit of what I do.
I mean, you mentioned some of the specific challenges for trans and other LGBTQ people, and you mentioned parents' health coverage.
Mm-hmm.
And from other conversations that we've had, it can become an issue, right? If healthcare is through the parents' insurance, and there's maybe gender affirming care, and they're not out to the parents.
I mean, yeah, that's a good chunk of the students that I work with. Like I said, I have this kind of area of my caseload that is specifically queer and trans students. And with trans students, I help them navigate, healthcare, getting hormone replacement therapy, or trying to get gender affirming surgery. And many of them are young and are on parents' insurance, and many of them are not out. And so that is, as I said, a huge barrier to care. So I've had many students this semester that I've had to either help them fill out an application for Medicaid, to try to get connected with off-campus healthcare to get HRT. Some of them are so closeted that even that step is scary. So we can't use insurance. We can't help. They can't pay for out-of-pocket costs at the campus health clinic. They don't want to fill out a Medicaid application, and so we're kind of left to scrounge for funding, or we're reaching out to clinics and see if they have like sliding fee programs. Or I just randomly happened to hear about an LGBTQ clinic through the College of Medicine at U of A that's just getting going to get students, of this specific population, the healthcare that they need. So it really is kind of like dancing on hot coals sometimes, depending on students' own comfort level with being out or taking these steps. So it's a lot of hand holding and juggling of things.
Let's talk about both of the levels of bureaucracy that you do navigate: the federal system for healthcare, as well as the university campus and setting that you're working in. You got this training for Medicaid enrollment.
Kind of advertise myself as not only doing application assistance, but troubleshooting applications. So I've had several students who either were on benefits, or had submitted an application temporarily approved, and just needed help figuring out what went wrong. And so from that standpoint, I just have them like create or like sign a consent for assisting, and then I can call and be like, what parts, and almost always it is literally a matter of incorrect documentation, not ineligibility. So the students that I'm working with are very obviously eligible for services, but the part that makes me the most angry always is that it's just a matter of like the documentation needing to be submitted correctly, quote unquote. So it's like Either they didn't provide like a written statement in the format that was needed. They didn't use the right wording, which is where I come in and I'm like, okay, well, let's just resubmit your application with the exact same information, but bolster it with more documentation, more written statements. You're going to need to provide this many like pay stubs, literally. So it's the advocacy takes form in just like knowing exactly what they need. They being the application reviewers, and then sometimes being annoying on the phone with an access eligibility worker or a sister hotline, just being like, what exactly did we do wrong, or did they do wrong, and where did it fall through? And those are the kind of answers that I can get that the student can't, because they don't know how to ask the right questions. So
it sounds very much like a falling through the cracks, not having the I's dotted and T's crossed, and kind of between the lines of what I'm hearing from you is that the system could be more responsive, more supportive in terms of not, getting hung up on, those stupid little things, but working better with the applicant.
It's wild. I mean, a couple examples just kind of like come into my mind of like, first of all, if I was not 27, internet literate, and knowing the phrasing of these questions, I don't know how I would navigate a system like that, which that is what that system is for people who maybe are under-resourced, don't have like public access to public education, don't have access to technology and know how to navigate these systems. It's just so inaccessible, and on so many levels, not just the wording of the questions, but the website itself is so hard to navigate. And if you don't know how to use that, you have to go in person, like to a site where they have an access assistant, which is, that's me, or go to the actual DES, Arizona DES, economic security office. So it's just wild to try to get somebody healthcare, and it's never about whether or not they're eligible. It's about whether they were compliant. So
I remember reading at one point about regulations requiring clear, plain English. And this sounds like some of the issues you run into, that it's just not explained in an easy to understand way.
I mean, they try, right? But even sometimes it's like, I can think of one question where it's literally, does the household have any other income? And this is actually something I messed up on a couple of weeks ago, where I was like, or actually, no, I was helping somebody else fill out an application. A coworker of mine was doing an application, and she was like, do you know what this question means? And I was like, well, technically, the household is who you're applying for. So it's the individual member.
It sounds like it's about your roommates, but it isn't,
and you
right?
would think, yeah, does the household have any other income? And you're going to be like, well, yeah, my roommate works at Papa John's. So, like, yes, the household has income. Like, we are rent-paying individuals, but they're not applying for Medicaid, and so they don't have to report income. So you're just trying to report the eligibility of the individual, but you still have to list your household members. So it's a very, like, again, long-winded process, and I think it could be a lot better, for sure.
So now to the university as an organization, where I know that you kind of go around, particularly in your work targeted towards helping LGBTQ, that you do a lot of sort of networking between offices and centers and providers and different support systems for different, like I've heard you talk about international students. That sounds kind of in that in between, a little bit between micro and macro, because I think some of the things that you're doing, like you talk about it, but they sound like you're putting things in place to open up possibilities of care.
Yeah, I mean, like, I try and connect with campus partners, just because, like, I see the university as like such a large institution that is incredibly resourced. And like specifically, we're working.
How big a campus are we talking?
I mean, it's over 50, like University of Arizona is over 50,000 students. Wow. And they have multiple campuses. Tucson is obviously like the main in-person campus, but it's a very large state university. And as much as they, claim to be on a very tight budget these days, it is still like a very rich institution.
There are resources around that you can find.
I guess what I try to do on a micro level is just like see if I can pull funding, or like my like more favorite things to do is to like collaborate on outreach, presentations, events, like ways and spaces that we can get people together. I recently like did a thing at the LGBTQ Center that was like a presentation on like getting gender affirming surgeries through the United Student Insurance at the university. So I don't know. I just try to like see what's already out there and try not to like reinvent the wheel, and in the process like meet cool people who are doing cool things and see if there's any way to like pull from their efforts.
So are you saying that sometimes you find that initial step towards getting care and becoming aware, a student becoming aware that of a possibility, are you saying that often that takes place just in like encounters out and around campus?
I'm not kidding. Like the power of just like meeting people is so huge, because like I'm also like newer to Tucson, right? Like I moved there a year and a half ago. I got this job. I just finished a year of this job, and I'm still kind of learning what's going on, like what resources there are, and I really try to acquire that knowledge by like meeting people and like being humble about what I know and don't know, about what resources are available. And so when I'm working with students, I can kind of come and be like, here's an array of options and ways that you could plug into these resources and communities, just so I don't, like I said, reinvent the wheel, or like try to create things that already exist.
So this is a podcast about the work, and we like to talk about tradecraft on here. So how would you describe the part of it that is about navigating organizations, navigating bureaucracies and systems, and what they're supposed to do, what they can do, that sort of thing? What is that?
I feel like it's a combination of skills. I mean, like my own personal perspective, all of my jobs have been within institutions. As much of an anti-institution person that I am, I just like always end up somehow in the belly of the beast, and I guess like I come with a level of jadedness around what's actually available to us. And so I think the skill is like creativity, like the motivation to innovatively like put resources together, or like the manipulation of the institutions I'm already a part of, maybe.
Social workers are intensely practical, like just really are down to that day-to-day level, and how clients and populations, communities are getting on and coping.
You really do see like material conditions for people. You see how inaccessible these systems are. You see just like the actual state of things for like working class people, for people of historically marginalized communities, and like I just think that comes with a level of, like I said, jadedness and maybe practicality around just the taking into account the lived experiences of people. And so I think my own pragmatism is like, I have so much hope for change in the world and like radical futures. And at the same time, like in working in these systems doing direct care, the number of times I've just run into a wall has like kind of beat my soul to a certain level.
Yeah. I mean, it sounds like the work of pushing the system to do what it's supposed to be doing for people, right?
Yeah, but quite honestly, like I feel like I have more capacity to do that work from outside of these institutions. This is kind of like what we were talking about the other day, where like I my own personal like work experiences have shown me that when I push for not even radical things, just things that I think are right, things that I think are aligned with my personal values, I am met with so much pushback and limitations and like questions of quote unquote liability is a very commonly used word in mental health and social work, which often I feel like puts institutions first over people.
So, and by liability, it's meant legal exposure and compliance.
Correct. It can be that. It can be specifically in the mental health field. It can threaten your licensure to practice. So people obviously take that very seriously because, and in their eyes, they can make the argument that that is promoting the sustainability of the care that we could. And this is something I always heard in the group home I worked at, is that like if we compromise our own accreditation or licensure as a facility,
You're out of business.
Right, you're out of business. Well, yeah. And also, like, think about all of the lives that we could be impacting in the future and how that would be sacrificed or lost should we.
Now that you're mentioning that previous experience of yours, and this has everything to do with the federal bureaucracy. As I mentioned in the intro, your job for a while was to help unaccompanied minor migrants, and they would be in the care and custody of your organization while you were trying to help steer them or connect them to a more longer term setting. And that had you interacting with the Office of Refugee Resettlement. Talk a little bit about, because I remember when you were doing that work.
And I mean, you said that they were in the custody of the nonprofit. They were really in the custody of the Office of Refugee Resettlement. We were a I guess grant funded. We had a contract with Office of Refugee Resettlement, and that was out of these programs were kind of created in response to several lawsuits that happened, like I want to say the early 2000s, about children's rights to, like, immigrant and migrant children's rights to education, recreation, living conditions while moving through this system. And so it basically was like the alternative to them being held by ICE because they're children. So they've contracted these child and family nonprofits across the country to house them and care for them under the regulations of the Office of Refugee Resettlement. And so
if I could jump in and explain for any listeners who might not be familiar, the regulations pertaining to ICE say that ICE is only supposed to hold these minors for 72 for a certain period.
I think the limit was 72 hours.
72 hours before passing them along from that border place, to an agency like the one you work for.
And often they would breach that. Mm-hmm. So, and we would be obligated to report it. So anytime that a kid would come to us, we would see the day that they crossed, we would see the day that we got them. Anytime that was over 72 hours, we would report it. I want to say as like a child abuse claim. Degree of relation also between the child and their sponsor also determines how fast and easy that, fast and easy, how quickly they can move through the system. And so that, for example, when they're being released to an uncle, it's actually, I believe that one was a parent, and that is a category 1
right.
family reunification. And so the different categories have different like requirements that you need to meet.
I mean, that's true. The entire immigration system
Right.
works that way because family sponsorship is a big part of how people come into the country.
They just needed to submit like a birth certificate that showed that, and like a legal form of ID to show that like I am the biological parent of this child. And they have their rights versus like other reunifications. They have to sometimes submit a like notarized document saying that like I'm like releasing my own parental rights to this person in the US. So it really varies. And I think I worked sometimes in the shelter, which is their kind of like first destination when they get to the US. But I was technically like full time at the group home, which these are kids who are what's called category 4. So they are without sponsors, either because the sponsors that they originally wanted to go to were not deemed fit by the government, or they just had nobody. And so these shelters are not designed to keep kids there for long sustainably. And so they get then like quite literally randomly shipped off to these longer term programs. And so these are kids that have more complex legal cases. And we're told when they get there to always explore family reunification again. And so I would ask them when they got there, do you have literally anybody in the US? Like, and I would, even though they had tried the reunification in a different program, some of these other programs are huge, and these case managers have caseloads that are unreasonable. And some of them are just kind of tossed out. And that happened with at least one kid that I worked with that had like a random friend of the family in Oregon. And I was just like, well, let's try it. And that was something that like...
Did it go through?
It did, but it took 3 months.
Case management, if you tell me, a lot of it involved getting kind of sign-offs and clearances from different offices and agencies?
Depending on like the requirements for the specific case. For a case like the one I was just talking about, that's a category 3 unrelated sponsor, which requires a very in-depth like interview process to try to prove relationship. The whole I wanted to go into social work when I started that job. And that whole experience and the way that I felt kids were positioned in that system felt like just so dehumanizing. Like it ripped so much personal agency from the kids I was working with. And even having to go through all of these bureaucratic processes without the guarantee of the kids of getting an outcome for the kids that was in their best interest, just like felt like there's no like this is not... and my own personal alignment around my views around borders and like someone's right to come here, I just was like, this is so ridiculous. Like, and this is the system that we have. And so I just, at the end of that job, just felt really hopeless. I was like, I can't affect change in a way that feels meaningful besides, being complicit in this kind of carceral system.
It doesn't help that that immigration is one of the most politically hot button, sensitive, distorted, paranoid,
racist, xenophobic.
And I was going to say, and it really doesn't help the turn that our politics has taken, especially in the last 8 years, with the demonization and the fear mongering. Shout out to everyone who works on this.
Yeah,
because
there's for sure it's been a more mainstream cultural shift in that sense. But I just also want to say that these systems have existed throughout all like regimes. Like it's regardless of, you know, whatever partisan power there is, these systems continue. And I think that like the Office of Refugee Resettlement and like the whole unaccompanied minor program tries to remain apolitical. It's still a very messed up system. That I felt after like 2 years of working there, I was just like, this is not right. Like, no matter how you cut it, no matter how much virtue signaling the nonprofits do, it just like child-centered decisions are not being made. And so I left and just was like, it's not for me.
Well, so kind of going back to that theme of how you see your professional path in the future, you're in this process of applying to grad school and looking towards a master in social work. I don't want to ask where you see yourself in 5 years because that's this, you know.
And I don't have an answer.
Right, so, why don't we instead have you say what you like about this type of work, especially what you hope to be, you know, the kinds of things you hope to be doing generally, and what you find most gratifying and satisfying about them.
Well, I mean, I just kind of talked about my like hopelessness that I experienced at that role, and that kind of like made me pause on the whole idea of entering social work. But I think it really like matters where you plug in, and to at least have an inner circle of people that you work with that are aligned with what you're about, to be able to have the liberty to do work that's ethically aligned. So like I feel like I have that right now, at least, just in that every project that I put together, they approve. They give me so much like independence and room to kind of like individualize my care, which is so important. And that is definitely something that I have not experienced before, where I have a way of doing things that I believe lines up with my own political values and like my stance on.
If anybody listens from the University of Arizona, you might be getting clues of how to keep you around.
Yeah, I mean, well, they've like, you know, they've been like so good to me, and I can get actually creative around like the things I think need to get done for students. Which, for example, in that case management job in Portland, there was no room. Like, really, it was A plus B equals C, and if B is not done correctly, then you don't get C, and that puts a huge barrier to care. And so now I kind of,
and it isn't much fun to boot.
Oh, it's awful. It's like honestly demoralizing. So yeah, no, I'm happy where I'm at. I think, like I said before, like it matters like where you plug in, and I hope that after an MSW I can kind of find places that are about what I'm about, so that I can practice as much as I can in alignment with my values, which is like at this point a deal breaker for me, because when I don't, the ramifications are just like not cool. So I think, yeah, just finding the right people who want to do the work in the ways that I'm down for is the route for me.
Words to live by. This has been so fun. Thank you so much for doing this.
Gosh, thank you for being my dad. Thank you for the things that you do in this world. I'm honored to be a guest and to have had you as a part of my political upbringing.
You're embarrassing me, and I might have to edit that out.
No, please.